Diagnostic research. In this video you will learn: what is diagnostic research? Example of diagnostic research. Types of diagnostic research. Steps in diagnostic research. Characteristics of diagnostic research. Advantages of diagnostic research. Disadvantages of diagnostic research. What is diagnostic research? Diagnostic research attempts to identify, examine and analyze problems to determine their causes. It can be conducted in a variety of ways. It is used to identify the causes of a problem. It is often used in business, healthcare and education to identify the root cause of a problem so that it can be solved. It provides an in-depth understanding of issues to help find appropriate solutions. Diagnostic research plays an important role in medicine. It helps detect diseases early, prevent illnesses, and personalize treatments. Example of diagnostic research. In the context of a business, consider a firm whose product is not selling well in the market. If they want to find out the reason behind this, the firm can employ diagnostic design research to figure out the cause and make improvements. To that end, the researchers thus employed will first gather data, maybe through surveys or questionnaires filled out by the target group, and find out what problems they had with the product. Once they know where it falls short, the firm can thus take appropriate measures to either improve it or recall it. Types of diagnostic research. There are two main types of diagnostic research: exploratory research, confirmatory research. Let's study them in detail. Exploratory research. This type of research is used to gather preliminary information about a problem. It is often used when the problem is not well understood. Confirmatory research. This type of research is used to test the hypotheses that were developed during exploratory research. It is often used when the problem is more well understood. Steps in diagnostic research. Step 1 is to define the problem that you are trying to solve. This involves identifying the symptoms of the problem and understanding its impact. Step 2 is to collect data about the problem. Once the problem has been defined, you need to collect data about the problem. This data can be collected through surveys, interviews, focus groups, or other methods. Step 3 is to analyze data. The data that you collect needs to be analyzed. This would be necessary to identify the factors that are contributing to the problem. This analysis can be done using statistical methods or qualitative methods. Step 4 is to develop solution. Once the factors that are contributing to the problem have been identified, you can develop solutions to address the problem. Step 5 is to implement solution. The solutions that you develop need to be implemented. This involves putting the solutions into practice and monitoring their effectiveness. Characteristics of diagnostic design. Neutrality. After collecting and analyzing the data, the projected results in the research should be free from bias and neutral. Reliability. Any researcher expects similar results every time, with regularly conducted studies. To accomplish that, your design must be reliable. Formulate your research questions to ensure the standard of results. Validity. There are multiple measuring tools available for diagnostic design studies. However, the proper measuring tools are the ones that help a researcher in studying the results in a way that aligns with the objective of the research. Generalization. The design outcome should apply to a population instead of a restricted sample. To further clarify, a generalized method implies that your survey can be conducted on any part of a population with similar accuracy. Applications of diagnostic research. Business. To identify issues affecting productivity, customer satisfaction, profitability, etc. Education. To determine factors inhibiting learning, student performance, and other institutional objectives. Healthcare. To recognize issues impacting patient outcomes efficiency of treatment protocols, and more. Social sciences. To recognize causes of social problems like crime, drug abuse, unemployment, etc. Methodologies in diagnostic research. Surveys. Interviews. Focus groups. Observational studies. Case studies. Let's look at each methodologies. Surveys. Surveys are a good way to collect quantitative data about a problem. Surveys can be used to ask participants about their experiences, opinions, and behaviors. Interviews. Interviews are a good way to collect qualitative data about a problem. Interviews can be used to ask participants in-depth questions about their experiences and opinions. Focus groups. Focus groups are a good way to collect both quantitative and qualitative data about a problem. Focus groups allow researchers to interact with participants in a group setting. Observational studies. Observational studies are a good way to collect data about the behavior of individuals or groups. Observational studies can be used to see the following: how people interact with each other, how they use products or services, and how they respond to different stimuli. Case studies. Case studies are a good way to collect data about a specific problem or issue. Case studies can be used to examine the following: the factors that contributed to a problem, the effects of a problem, or the effectiveness of a solution. Advantages of diagnostic research. It can help to identify the root cause of a problem. This is essential for solving the problem effectively. It can help to identify the factors that are contributing to the problem. This can help to prevent the problem from recurring. It can help to develop solutions that are tailored to the specific problem. This can increase the chances of success. It can help to improve decision-making. By understanding the root cause of a problem, decision-makers can make better decisions about how to address it. Disadvantages of diagnostic research. Diagnostic research can be a lengthy and expensive process. This is because it involves collecting data from a variety of sources and analyzing the data in a rigorous manner. There can be multiple factors that contribute to a problem, hence it can be difficult to identify the root cause. This can be especially challenging when the problem is complex or when there is a lack of data. The results of diagnostic research may not be generalizable. This is because the research is typically conducted in a specific context. The researcher's biases may influence the results of diagnostic research. This is because the researcher handles the data collection and its analysis. Conclusion. Diagnostic research is a valuable tool. It helps identify the causes of problems and develop solutions to address them. It aids policymaking by providing evidence-based insights into key challenges facing government sectors and programs. It is a complex process, but it can be very effective when done correctly.